Okay, so we are now live for our town hall meeting for Get Covered Illinois, and I'm LaShawn Ford, State Rep of the 8th District, and we have joining us today Brian Gorman from the Get Covered Illinois, and we have Lauren Polite from HFS, and we have Dr. Tom Huggett from Lawndale Christian Community Center. We think it's critical that we have this town hall meeting for a number of reasons. One reason is I always like to say that our favorite son, one of our favorite sons from Illinois, fought so hard in Washington to make sure that people in the country had health care or health insurance. And it wasn't an easy fight, but it was one of the biggest changes that happened in American history in a very long time. And it's a big deal, as Joe Biden said. And because of that, we want to make sure that everyone has an opportunity to get covered. And I will just tell you some very important dates, and Brian will tell us all about those dates. It starts with November 1 through December 15th. And then we will also talk about people that receive Medicaid, when they could be covered. And Brian, you want to take it from here?
I do. And I first want to thank you, Representative, for the opportunity to come out virtually come out and share some information. As you mentioned, open enrollment is just around the corner, and that's the time of year where people who are eligible for marketplace plans can enroll. But we'll also be hearing from our colleagues at HFS to share the information that even if you're Medicaid eligible, that may be a year-round effort as well. So, and one other thing before I get started and share a few slides, I know that you and I have go way back, and even before the ACA was officially unveiled, you were advocating at the community level to talk about what health reform meant, and so I'm really honored to kick off our open enrollment campaign with you this evening. So thanks so much. Okay, let me just share my screen here. I got a few slides. There we go. All right. Again, my name is Brian Gorman. I am the Director of Outreach and Consumer Education for Get Covered Illinois. We are the state's official health marketplace. We're housed within the Illinois Department of Insurance. And every year around this time, we spend a lot of our efforts going around the state, usually in person in community centers and public libraries, and letting people know that open enrollment is coming up. But this year, because of COVID and interest of public health, we're really excited to be doing this through technology. So we're going to walk you through a few slides, some basic information about what the marketplace is and what folks need to know, some of the benefits of the marketplace and the Affordable Care Act, most importantly, and then segue into some other benefits within the Affordable Care Act as well. So I'm going to talk a little bit about some of the key components of the ACA. We're going to talk about the health insurance marketplace, and then we're going to talk with our colleagues at HFS. Lauren Polite is here to join us to talk about the aid, the applications for benefits and eligibility. And obviously, we know that health insurance is sometimes confusing and daunting. So we want to let people know how to get the assistance to kind of walk them through the process. We are a resource for you, not just on this call, but working through Representative Ford's office and through the Illinois Department of Insurance to let you know that we're here for you. So real quick, I want to talk a little bit about the Affordable Care Act. And I know that it's been passed into law since 2010, and Vice President Biden did call it a big deal. I'm grateful that you chose some family-friendly words to describe the experience, Representative. But the bottom line, I think, is a sea change for particularly Illinois consumers, and it allowed people to purchase private insurance without without worrying about whether they had a pre-existing condition. Women couldn't be charged more because of who they were than men. And most importantly, there was financial assistance to help pay the premiums if you met a certain income threshold. But Illinois, we're very proud of our work. We're one of the first states to actually expand Medicaid to childless adults. And that's something that has seen hundreds of thousands of Illinois residents have the peace and security of knowing that they have health insurance coverage either through one of these two very important programs. So when we talk about what the protections are of the Affordable Care Act and the ACA marketplace, one of the things that we like to point to is it does establish 10 essential health benefit categories, and we'll go through that. Essentially what every single plan that's sold in the marketplace people are eligible for. It also provides coverage with people for pre-existing conditions. I know a lot in the news, people have been talking about pre-existing conditions. For some young folks, they may not even know that this was a thing in the past, but because of the ACA, that you could not be denied enrollment in a plan if you had some sort of a series of conditions to prevent you from getting that coverage. It eliminates the annual and lifetime dollar limits. There was a time when essentially your coverage through your insurance plan says, we've paid enough. You're on your own. Those caps, those maximum out-of-pocket caps are no longer an issue. And these are really important, these 10 essential health benefits. I know that they seem technical and kind of wonky in nature, but the bottom line is that all of these benefits are covered at various levels in your insurance plans that are sold through the marketplace or through Medicaid. And this includes maternity and newborn care, mental health and substance use disorder treatments, prescription drugs, lab services, and preventive care and wellness services. Obviously, we're getting into the flu season, and we're encouraging everyone to take advantage of seeing your physician and getting the preventive care as we go into there. And I know Dr. Huggett is going to talk real quickly about that as well. So the question I think people ask is like, well, open enrollment is coming up. November 1 is around the corner. Who can enroll? And these are just some basic questions. If you live in the United States, if you are a U.S. citizen or national, which means legally present here in Illinois, if you're not incarcerated, and obviously you do not have currently health insurance through your employer, through Medicare, Medicaid, CHIP, or other sources which provides what they refer to as qualifying health coverage. And roughly about 300,000 people every year are eligible for marketplace plans here in Illinois. So the when, like obviously that's why we're here right now. Open enrollment begins November 1, December 15th. It's a very short 6-week window where people need to take the time to shop and see what they're eligible for and figure out what their benefits are and find out what plan works for them and their families. All summer long, we had been kind of communicating about special enrollment periods. There are a number of different qualifying life events, like losing your health coverage from job loss. I know it's an issue across the country of people being separated from their employer-based coverage. If you've moved to a different area, if you get married, having a baby, you may only have 60 days after the life event to enroll. But the important thing for people here today is that the open enrollment this year is right around the corner, just 10 short days away. So you should start making plans to enroll if you are in need of coverage and you are eligible. Real quick, we just talked about those SEPs, losing your health coverage from job loss. If you're no longer eligible for Medicaid, people may have an income change where they're no longer eligible for Medicaid. If you move to a new zip code or county, which is outside of your insurance rating area, if you've gotten married, these are all examples of what may trigger. But again, you don't have to qualify for an SEP to enroll during the open enrollment period. Anybody can shop for a plan. Even if you currently have a plan that you like, we're encouraging all residents to shop for plans when they get posted, because your family circumstances may have changed, your financial circumstances may have changed, and for sure the plans themselves will change as well. So where do I find help? Again, we talked about this, so that health insurance is not the most intuitive program in the world. but we at Get Covered in the Department of Insurance have tried to put together some resources for you to make it as easy as possible. So on your left there, you'll see a screen grab from GetCoveredIllinois.gov, our new and improved website, where you can get free help. And all you gotta do is click on that link. There's a tool both in English and in Spanish that connects you to someone in your area that can assist you. In the past, that would be something that would be in-person help, where you could go to their office or meet them at the library. Now, through a phone call, they can walk you through what your options are and what your benefits are. Now, Illinois is what they call a federally facilitated marketplace, where people ultimately select and choose their plans on the federal website. And that's the place where you can kind of see what you're eligible for in terms of tax credits. And then you can make those selections there. So you start the process by going to Get Covered Illinois. You find find that assistance. But then you also, when the time to actually start enrolling and shopping, that will take place at healthcare.gov. But your first place to go should be GetCoveredIllinois.gov. And I talked a little bit about premium tax credits, and it's just a fancy way of saying that there are help to make your payments, your premium payments in advance, depending on if you qualify. So they're refundable credits to help cover the cost of your monthly premiums. Sometimes people call them subsidies or discounts, but the important thing is that more than 80% of people who are shopping for plans on the marketplace through healthcare.gov do receive some form of tax credits to help pay their premiums each month. So it's applied on a sliding scale. But the only way to ensure that you actually can receive those tax credits is through Get Covered Illinois and healthcare.gov. So again, the marketplace or Medicaid, people are like, well, I know I need coverage. I don't know whether I'm marketplace eligible or Medicaid eligible. And we're not asking people to know this. What we're trying to do is develop a tool for people to know what they are eligible for. So when open enrollment begins, there will be a tool on our website where people can just answer some basic information about their household size, their monthly income, whether or not someone in their household is pregnant or expecting. And then we'll send you where you need to go. So it kind of takes the decision-making process, at least on the front end, on what we need to know. As long as you come to Get Covered Illinois, we can get you the resources, the information you need, and get you started and on your way. So with that, I would love to turn it over to my colleague, Lauren Polite from Healthcare and Family Services, HFS, and then she can kind of walk you through the application for benefits eligibility and ABE. Lauren, are you there? And I will drive your deck. So tell me whenever you want to flip it, and I'll do that.
Okay, thanks, Brian. First, I want to thank Representative Ford for having this. You are the first one that is hosting, so you get the prize. I also want to thank Dr. Huggert for being here. Medicaid could not function without our incredible network of community health centers. They provide not just medical care, but so many other social services. And I'm pleased that we have such a good relationship in working with PHCA, the association. And again, always just am amazed by the efforts of our community health centers and what they do. So thank you, Dr. Hubert. Okay, Brian, go ahead. So I'm going to talk about Medicaid, and then we can take questions at the end, and whatever I can't answer, we'll be sure to get back to you through the representative's office. So again, as Medicaid is a state and federally funded program, healthcare program, but we also have some parts of the program that are entirely state funded. So there's a lot of different terminology and word, like sort of names. And so try to keep that pretty simple. We're just going to call it Medicaid. And it does include what we call the ACA adults, it's the Affordable Care Act adults. And that's what a new group of people we were able to cover through the ACA, as Brian mentioned. So those were adults who previously were not eligible for Medicaid because they didn't have any children 18 or under or were not seniors or people with disabilities. So this is a huge category that we were able to add to Medicaid through the Affordable Care Act funding. We also have our All Kids program, which is really a mix of sort of Medicaid and then CHIP, Children's Health Insurance Program money that Brian mentioned, but again, let's just call it sort of considered all Medicaid. We have family care, which is parents of children, and we have what's moms and babies. So those are pregnant women, and then their babies are eligible up to the first year. And then of course, they typically, just go into All Kids. So ABE is our online application, and we started this when the Affordable Care Act rolled out. You can also apply for food stamps and cash assistance through the same application. So we have a combined application. And there's also something called the Medicare Savings Program, which is a program that helps people under 100% of poverty pay their Medicare premiums. So it doesn't provide services, it just provides financial assistance, again, to help afford Medicare premiums, because we want people to be on Medicare. You can be on Medicare and Medicaid, and that's fine, but if you're on Medicare, then we bill Medicare first. So it's to our advantage for people to stay on Medicare, so we want to help them to be able to afford the premium. There is also something called emergency medical, and this is for people who meet all of the requirements of Medicaid, except they may not meet the citizenship requirements. So they may not be meet the 5-year legal permanent resident bar, or be citizens. And so we do have emergency medical that they can qualify for, and again, they apply for that through ABE. So we've tried to make it really easy. Go to ABE and you can apply for all these benefits. And again, you can go anytime. Unlike the marketplace, ABE is open 24 hours a day, 365 days a year. And so we want people to get covered as quickly as possible. And we've tried to make it as easy as possible. So go ahead, Brian, next slide. So these are just the general requirements for Medicaid. So you have to be a resident of Illinois. And so if you move to Illinois from another state and someone was on Medicaid in another state, they have to get that other state's Medicaid canceled before they can get onto our Medicaid, right? You can't be on 2 programs at once. So you have to be a resident. And then meet certain income eligibility. And so we're going to show you a chart. And then there's the citizenship. So again, an adult must be a citizen or a legal permanent resident for 5 years, or a covered refugee. There's some certain protected populations. Then children and pregnant women, though, do not have to meet the citizenship requirements to be eligible, because we really want them to get covered. It's really important that they have health care. And so those citizenship requirements do not apply to children and pregnant women. And again, for children, we do need an adult to fill out the application, but the citizenship of that parent, if that parent is not applying for Medicaid, we don't look at that citizenship. So people should not be afraid to apply for Medicaid for their children based on their own immigration status. We only, look at the child. And again, since citizenship requirements don't apply to the children, we want to get them covered. So we really encourage people to apply for Medicaid and not be afraid or not be worried about that. And then, so here's the income qualifications. Now, what I want you to make sure you understand is you'll notice there's very different levels depending on what population you fall into. So it can be very confusing, we know, especially with the marketplace, because you cannot qualify. If you're eligible for Medicaid, then you're not eligible for tax subsidies on the marketplace. So that's why it's always good to apply for Medicaid. I mean, that's why the screener is so important, because we don't want you to start on the marketplace and then be brought back to Medicaid and then have to wait for a denial to go back to the marketplace. So the children in Illinois, we have a very high eligibility threshold. So in some cases, parents may not qualify for Medicaid in Illinois, but the children will. And so in that case, the family does get separated. So the kids will get an approval letter, and then the adults may not. And so then the adults take that over to the marketplace and buy coverage on the marketplace. We also have a higher income threshold for pregnant women. Again, we really want pregnant women to have coverage. And then the age of blind and disabled, that is 100% of poverty. But if someone makes more than that, but just not too much more, we have something called a spend down program. So they can basically turn in their receipts and then spend down to qualify for Medicaid in certain months. So there's a lot of information on our website at hfs.illinois.gov. And but again, happy to answer questions that you can send through the representative's office. So go ahead, next slide, Brian. This is just a little more information about the age of blind and disabled. There is an asset test, so asset or resource test for that population. But during the COVID public health emergency, we are not applying that asset test. So if you are 65 or older, age of blind or disabled, if you apply right now, we're not looking at your assets. Doesn't mean that we won't look at your assets once the public health emergency is over, especially during a redetermination, but right now we're not looking at that. Okay, Brian. All right, there's a couple other changes that we made during COVID-19 public health emergency. We want to make sure people get coverage. And so we want, and if they're on Medicaid, we want to make sure they stay on Medicaid, again, especially during the public health emergency. So we are allowing more self-attestation of things like income and residency and things like that. So we do verify things electronically, but if we can't check it electronically, especially income, we can't always verify that. We will take self-attestation. We also have what's called presumptive eligibility for family care, so parents and adults, and that just means we will basically look at basic information, and if it looks like someone's eligible, we're going to put them on until the caseworkers have time to process the entire application. So it's a way to get people coverage more quickly. We've waived all of our cost sharing, so there's no premiums, no co-payments for, that's health benefits for workers with disability, all kids, or veterans care. Again, we don't want any reason why anyone would have to pay money or any reason why we have to, end their coverage. Right now, there are no redeterminations going out. So usually we send out redeterminations once a year. And about 70% of those are requiring people to return them to us. And if they don't return them, then their coverage gets canceled. But right now, so again, we don't want to be processing those. We want people to stay on. So there's no redeterminations being mailed out. So if you've been looking for it during the public health emergency, we're not mailing those out. The only thing that's going out is if someone has SNAP and medical, the SNAP redeterminations are still going out. And so we do really, get those back in. We also are allowing more like phone things to be done over the phone without as much sort of authorization. And places like Lawndale Christian Certified Application Counselors, those staff can help people over the phone as well submit applications through AID using a consent form. And then on the care side, we've done a lot of expanded coverage of telehealth visits, and we've suspended things like some prior authorizations. Again, we want people to get care. We want it to get care where they're comfortable getting care. We don't want them going into the doctor's office if they're not comfortable. but we still want them to see their doctor. Okay, the next one. All right, so COVID testing and treatment might be on people's minds. Just to make sure everyone knows, Medicaid and Medicare recipients get testing and treatment at no cost. Emergency medical that I talked about is available for non-citizens who, again, meet the other eligibility requirements. And that will, again, cover testing and treatment. If someone's not eligible for Medicaid or emergency medical, COVID tests still can be free. They need to check the site they go to. The federal government has set up a fund that providers can bill for people who are uninsured. And so that's that last bullet. So if someone needs treatment, also, again, they should definitely go to the hospital and get care, because there are funds set up for the hospitals to get reimbursed. So don't worry, everyone needs to, get the care they need. Okay, next one. So these are just some basic Medicaid covered services. They look a lot like what Brian talked about on the 10 essential benefits. The one key difference is transportation. So Medicaid covers transportation to and from providers' offices, and also they will provide it, take you if someone wants to get a flu shot, like, at the CVS or Walgreens or at a free clinic or drugstore, they'll take you there too. So that all happens either through our managed care organizations or through HFS directly. It's a very good benefit package. Okay, next one. So in Illinois, we have most of our populations are required to enroll with a managed care organization. Managed care organizations cover all the same benefits plus some additional benefits that Medicaid HFS covers. And then they also have care coordinators and people, some really special programs to help manage chronic health conditions. They help people find providers. They help people transition out of hospitals or facilities, and they connect to community resources. So everyone has to pick a managed care organization and a primary care provider. The most important thing is, for once you pick a managed care organization, you have to go to a provider that's in their network. So that's a really important thing to understand about managed care organizations. Next slide, Brian. This is our current list of managed care organizations that you have to choose from. So as you can see, we have a lot of the big commercial plans. Aetna Better Health.
Oh, sorry.
Blue Cross Family Community Health Plan, Meridian Health Plan, Molina, and then if someone's in Cook County, which I assume they will be, is County Care Health Plan. So we have, again, a good variety. There's a lot of overlap in providers. I think all of the community health centers are in, I believe, every MCO network. And then, but then you want to pick, like, based on your hospital, and if you, go to a lab or, specialist, if you're seeing in the middle of treatment, things like that. Okay. And I saw some questions coming in, and we can answer those at the end. So I'll pull them up.
Yeah. So I think that Lauren quickly mentioned, help and certified application counselors. And Illinois is partnering with a number of different organizations all throughout the state and right here in Chicago, of local assisters who are certified and trained to provide enrollment services for everybody. And so you can go to Get Covered Illinois, you can type in your zip code, and then there will be a screen where there are certified trained assisters in your area who you can call on the phone, schedule an appointment over the phone, and they can work with you and attest, as Lauren said, that they're going to protect your information and do it the right way and the standards that have been set up. So really important. Again, we understand that health insurance and getting covered is sometimes a daunting experience, and there's tools and resources for you to help. And again, we're committed at Get Covered and Department of Insurance to working very closely with our other agencies across the state because of the benefits that many people are eligible for. So, some families are marketplace eligible, but their children are all kids. But those families may also be eligible for SNAP and TANF. And obviously, we work very closely with public health because of what's going on with COVID, and we will continue to do that. So breaking down silos as agencies across the state. Again, this is really important. There's a number of different websites and tools for people. And if you have questions or concerns, this is a resource for you. But I wanted to thank you, Representative, for the opportunity to kind of spread some information and certainly to answer questions that people might have as we're getting to a very important time of year for healthcare and coverage here in Illinois.
One thing that you made clear, you said that if you're on Medicaid, there is no closed enrollment. Is that right? You can apply at any time, right?
Lauren, go ahead.
Correct. Yep. They can apply anytime. And then what happens is, so the month in which someone applies, if they're eligible, it starts back to the first of the month in which they applied, but they can also request coverage 3 months before that. So 3 months of retroactive coverage if they have medical bills or anything that they want to, that they need coverage for. So yes, they can apply any time. We look at 30 days of income of the 30 days of your past income. But if you provide information that shows us that you're losing your job or there's something coming up, we will take all that into consideration. I think that's one of the other big things and has caused a little bit of back and forth between the marketplace and Medicaid is the marketplace looks at annual income based on someone's tax returns for the past year. And so, we know that may not be near the situation that's happening this year. And I'm sure there's sort of accommodations made for that. For Medicaid, we just look at the last 30 days of coverage. Self-employed, it gets a little tricky, but we have a form that self-employed fill out that takes into account sort of, business income and expenses. So they've tried to align better with the marketplace, but it's still, especially people right on that edge, people who have maybe around the holidays, make a little bit above or below, it gets a little tricky, but we have a good relationship with Get Covered and we try to really work out those issues for someone. So
it is, before we bring on the next speaker, children get covered, children are covered regardless, is that right? Or are they still, I did see the guidelines. So if a parent makes a certain amount, they may not be under all kids. The parents may not, the kid may not qualify if the parents make a certain amount of money.
So yes, I think what you're getting at, one of the really most popular benefits of the Affordable Care Act is that children on private marketplace plans can be up to the age of 26, can be on their parents' coverage. And so, if they meet a certain threshold for coverage, they're eligible to be on their parents' plan up until the age of 26. But what happens a lot in Illinois is that because of our really generous benefits for children on Medicaid, there's moments where parents may be on a marketplace plan, but because of the household income, the children may be on Medicaid plans, and it sometimes can be confusing for people as they're enrolling. But really, it's a nice benefit to not have to actually to pay as much for your children as you would normally. So yes.
Yeah, and Laura.
Yeah, I think that's right. I mean, I think, again, we go up to 300% of the poverty level for children. There's, it's sort of broken. At some level, it's totally free. And then we have premium level 1 and premium level 2, but the premiums are extremely affordable. And we're also looking at making the change there. But I think that's, you know, the adults are at 133% of poverty, but the children are 300. So, but again, it it depends on the parents' income, and it also is tied to it who file, you know, if there are dependents on tax returns and things like that. Yeah.
Okay. All right. Are we ready for Dr. Huggett? Or do we have anyone else from the agencies to speak?
No, that's Dr. Huggett. Let's hear.
So Dr. Huggett, you know, I just asked you a few questions before you come on, Dr. Huggett. I think what's important is people really think that if you're on Medicaid, you don't have insurance, that it's Medicaid as if it's not like what a private person has. What do you say about that? A person on Medicaid versus a person that may have Blue Cross and Blue Shield at Lindale, how do you treat them?
Yes, thanks, Representative Ford, for holding this. And I got to say, you got some heavy hitters here with Brian and Lauren. So we really are lucky to have the experts on. I appreciate that. And you are absolutely correct. I mean, yeah, we would treat somebody just the same whether they had, you know, private Blue Cross Blue Shield PPO insurance or insurance through the exchange or Medicaid. So the only time that we would look at that is if we would have to make a referral. But how we treat them, how we treat their diabetes or high blood pressure, how we get them the medications that they need would be no different. I kind of, if you don't mind, I'd like to kind of underline a couple of small, well, not so small things that have been really an advantage to many of the patients that we serve at Lundell Christian Health Center and on the west side of Chicago. And in particular, we serve folks who are experiencing homelessness in shelters. And I have to say that, you know, before the Affordable Care Act, before Obamacare, only 10% of our folks had insurance. And now 75 to 80% have insurance. That has just made such a huge difference in being able to access medications for their high blood pressure and for their diabetes. And now with this opioid overdose epidemic that's happening throughout the country, but certainly hitting us very hard on the West Side, and that you're, you know, working hard on with the West Side Heroin Task Force, what we're able to do now is get patients the medications that they need. They can get their Suboxone, they can get their Narcan to, you know, to treat overdoses should they happen. That was not even possible before the Affordable Care Act. So being able to actually get treatment for opioid use disorder and to leave heroin behind is a huge difference. The other big possibility is for people getting treatment for their mental health or psychiatric conditions. Medications for those conditions are really, really expensive. And so to have insurance coverage so people can be stabilized and not be in the hospital, not go to the emergency room, and really join their families again has really been a big advantage to having expanded insurance through the Affordable Care Act. I think that there are other two highlights that Lauren emphasized, but these are you know, that people don't really realize is that, you know, people can get eye exams and eyeglasses. So, you know, people say, oh, I can't see as well. And some people don't realize that, you know, Medicaid covers that they can go to see an optometrist, get a proper exam, get a proper prescription, and get a pair of eyeglasses. That makes a huge difference for many of our folks. And then, you know, people can say, well, you know, I'd like to do that, or I'd like to go to the specialist, but I don't have any way to do that. And many people do not realize that Medicaid does cover those transportation costs, and that is a huge advantage and benefit for our patients.
Medication, you know, I know that medication is very expensive for a person that may have private insurance. You know, if I have Blue Cross and Blue Shield PPO, I don't know, is it cheaper for a person with Medicaid to get their medication compared to a private insurer? I mean, I'm just trying to, you know, make sure people understand the real benefits that this coverage has for them.
Yes, you know, it's funny that you would bring that up, because sometimes what you have to pay at the drugstore, the copays to pick up your medication, is quite a bit more if you actually have PPO insurance than if you have Medicaid. So sometimes the copay may be, you know, 15, 25, you know, 40 or $50 if you would have PPO. And it's generally $2 or $3 or $4 or $5 for Medicaid, depending on the medication. Now, sometimes that is still a barrier for some folks. So sometimes that's something that, you know, we're working on in particular, but I think that there is quite a difference there.
One person, I know that there's a standing order for Narcan by the Department of Public Health. And I've learned that a person that's on Medicare versus Medicaid or private insurance, the cost is different. And so a person that's on Medicaid have the ability to go and get their Narcan from the pharmacist without a copay. But a person that's on Medicare or a PPO, there's a copay and it's very expensive. So there are some major benefits to having Medicaid, and I think that people should be proud to have it and they should take advantage of it.
I'd like to just tell one story, if I could, Rep. Ford, about the advantage of Medicaid. This was fairly early, you know, maybe 2 or 3 years into Medicaid, and I was seeing one of the folks that we see, and he had just recently gotten Medicaid, was over the age of 50, and we talk about preventive health care, as Brian was mentioning. And this gentleman was not having any symptoms, didn't have any family history of cancer, but you know, we said, well, you know, it's really important to get a colonoscopy. It's really important. You're over 50 years old. You have Medicaid now. It'll cover that. Let's do that colonoscopy. So we referred him for a colonoscopy, and much to our surprise, much to the patient's surprise, a cancer was found. So a cancer was found small enough that they were able to take it out. He did not have a colostomy, never had radiation, never had chemotherapy, and was cured of his cancer just because it was caught early enough by a colonoscopy. And he was told he had no symptoms, and he had no bleeding, no weight loss, no pain, nothing like that. But that was found because he had insurance. That was found because he was able to get preventive health care and get the colonoscopy that he needed to find that cancer before it caused problems. And he's still doing fine. So that really is showing that we can use our insurance for preventive health care, and especially now. So everybody get your flu shot. So I got to get that in, because this is the time where we need to get our flu shots right now, especially if we're getting another wave of coronavirus. And certainly insurance will cover that, and you can get your flu shots now. So I got to get that in, Rep.
Thank you. I know we have some questions. Lauren, you said you were going to pick them up?
Yes, so I've been trying to respond. There is definitely a timing issue, I think, on like if people are losing their job or people are on unemployment. You know, the unemployment is considered income for the purposes of Medicaid. So I think you're going to have to look at the level of the unemployment. But then if the unemployment ends, then, you know, that's, so I think if we have a minute, I would like to take time just to talk about a little bit of the, again, I mentioned the back and forth, and it really is still something that can be hard on people. So, so if someone is eligible for marketplace, subsidies for marketplace plan now during open enrollment, then they should go ahead and enroll. But if their income changes, Brian, I think confirm this, but the most important thing is to report that change to the marketplace.
Right.
Because then the marketplace will reassess whether they're still eligible for subsidies. So the subsidies may go up if the income has gone down, or they may say, you know what, you're eligible for Medicaid. And then what the nice thing is that the state and the marketplace transfer applications back and forth. So when Medicaid determines that someone is over income, we send the application to the marketplace, and then we send a letter to the individual that says, you're over income, but we sent your application to the marketplace, create an account, go in and, you know, and complete the process.
Yes.
So, but then again, the most important thing is to be in touch with the marketplace, because what happens is if someone is on the marketplace getting subsidies, but then they somehow also are on Medicaid. You know, as I said, you can't be on both, right? Because you're kind of getting subsidized twice.
Correct.
And there have been cases where people have had to repay their subsidies, which I don't want anyone to worry about. I just want everyone to be sure that they're reporting any changes to the marketplace, so that if they are no longer eligible for subsidies, that the marketplace knows that, and that they are then sent over to Medicaid. So again, the nice thing with Medicaid is that we will actually go retroactive, but the marketplace goes prospective, right? So if you apply in the marketplace, you know, you have to finish the application by the middle of the month for your coverage to start the following month. Medicaid doesn't have those issues. We want to cover more, so we go back.
So
but the marketplace needs to pay their premiums, they go forward.
The most important thing that people who are on marketplace, they currently have marketplace plans, the best advice that I can give you is to shop around for a new plan and update your information for plan year 2021. And that means that the plans for marketplace began on January 1, 2021. Because as Lauren mentions, the plans changed. I mean, essentially the plans changed from year to year. We haven't released the plans for, we'll be doing that shortly for the upcoming year. The prices have changed, and people's household income have changed. So how your household income applies to the formula that the federal government uses to determine what your subsidy is changes from year to year. So it's important that people, even if you're happy with the plan, to take some time, look at what their options are, because there may be a better benefit for you by shopping, and things change every year. But that is a really good point. And I know that the question is, I'm losing my coverage in the middle of the month. You know, take your time to shop for starting November 1, and make the right decision for you, because there's a lot of benefits out there, not just in terms of the quality and of the care, but the financial benefits of paying those premiums.
Right, and just because you get a letter from the marketplace, I mean, we've seen this in the past, just because you get a letter from the marketplace saying, hey, you've been on a plan, time to re-enroll, again, doesn't mean you actually, if your circumstances have changed, you may want to apply on Medicaid and see if you're eligible, because financially, you know, as the doctor mentioned, it is like most if not all of our managed care plans have waived co-payments for all of their services. So while, you know, Medicaid fee for service still has some co-pays, not during the public health emergency, but more in general, the MCOs don't. And they also have a lot of incentive programs to go and seek care, especially for pregnant women and children getting immunizations. They have services like free car seats and diapers. So there's, again, I think back to your point of sort of saying, this is a really good program. And so if you're eligible, we really hope you'll take advantage of it. And what I tell people, especially when we first rolled out sort of that 55 to 64-year-old group, that never thought they would be applying for Medicaid, right? Because they always had a good job. They thought they'd have a retirement plan, and it didn't work out that way. Medicaid is here for when you need it. We don't expect you will always need it, but please take advantage of it when you do need it, because that's what it's here for.
So there's a question from someone on the phone. Their hand is raised. That's 773-909-0137.
So the question, Representative, is about their losing their care in the middle of the month. Do they have to wait till December 1?
Okay, we answered that person's question.
Yeah, I started answering, and I asked them a question back. So what I would do is probably go ahead and apply for Medicaid like December 1st, which is the first day you will be uninsured. Because I don't know what unless you have pretty low income and you think your October, because again, if you apply in November, we're going to look at your October income. If you apply in December, we'll look at November income, and you'll be uninsured. So Medicaid, someone can have private insurance and still qualify for Medicaid. Medicaid acts as a secondary insurance if someone has sort of minimal coverage or doesn't cover everything. But again, you have to meet the income, the income guidelines. So, but
And I think it's a good time to plug the consumer assistance elements of Get Covered Illinois, where this is a complicated circumstance. But when somebody who's certified and trained that understands both the marketplace side and the Medicaid side and the rules of both, and has access to your personal information in a way that allows them to make the best determination, I think that's good for the client. So these are kind of, exercises, but really, this is a real circumstance for you and your family, and you got to work through it. And then we want to let you know that there's help for you to walk you through that process.
Okay, and there was a question about SNAP. Maybe I can answer the question for them. I know that's DHS, but did we answer that question for?
I did. I don't think there's any restrictions on. I mean, I think people, it doesn't matter what other programs you're on, you should go ahead and apply for SNAP. So I'm not a SNAP expert, but I would encourage someone to apply if they think they're eligible. There's also, a lot of changes in the SNAP rules with the public health emergency. So I think it's better to just apply. There's no downside. I wanted to make one other plug for Medicaid. We know that kids are at home. We know they may not be getting their therapies or their immunizations or their screenings because they typically get those at school. Please, 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 parents, reach out to your managed care organizations and arrange for those kids to get the services in the community. We've been talking to our managed care companies about it. We've been talking to CPS. We're trying to get more, better communication with ISB and other schools, but please don't let the kids go without the services.
Yes, Rep Ford, I can echo that. Many clinics were kind of closed or using just telehealth, but now many clinics, including ours at Lawndale Christian Health Center, are open for appointments. And one of the things that we certainly are pushing, as Lauren said, is to make sure that kids get the developmental screening that they need and get the immunizations that they need, and especially right now, getting their flu shots. So the kids need flu shots. Everybody over the age of 6 months and above, everyone needs a flu shot.
Thank you, Dr. Huggett. And Brian, if there are no more questions that we need to answer, that's great. We could wrap this up with any closing remarks from, we go right away with Brian to help wrap it up.
Well, thank you. And again, I want to thank Dr. and Lauren for their contribution. It was a really, really helpful dialogue. And this is an important time of year for a number of different reasons. Obviously, we're talking about a public health emergency that is leaving none of us untouched. And so all we can do is to spread some information, encourage people to take advantage of the benefits which are available to you, whether that's your immunizations, the enrolling in Medicaid, the reduced premiums. But the most important thing people can do is to get covered. And we talk about all the things that are in the Affordable Care Act, the Obamacare, the essential health benefits. We talk about this all the time. They're amazing and they're life-changing for people, but they cannot be taken advantage of if people don't take that step to enroll. So, you can all, two things: talk to your friends and family about what their coverage plan is, and two, make sure you get your flu vaccinations, and then make sure you get your flu vaccinations because it's that important.
Well, for Get Covered, I'm LaShawn. This is Brian and Lauren, Dr. Huggett. You guys have a great day.
Thank you so much.
All right. Bye-bye.